Data from U.S. hospitals shows the Pfizer vaccine prevents nearly all serious COVID symptoms in kids ages 12 to 18 who receive both shots. Here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Thanks for being here, Dr. Moffatt.
Sure. Good to see you both.
All right, Dr. Moffatt, let's start with a closer look at the numbers. This graphic that we're going to put on the screen here shows a breakdown of adolescents admitted to a hospital with COVID-19 between July 1st and October 25th. About 4% were fully vaccinated. Of course, in that window, the vaccine for kids 5 to 11 was not available yet. 96% were not vaccinated. The rest, less than 1%, were partially vaccinated. Are you seeing similar breakdowns at Children's?
I would say that what we're seeing is fairly similar. I think it should be pointed out that those data were collected largely when Delta was the predominant variant that was being transmitted, and we know that the effectiveness of these vaccines was probably even better at preventing infection, any infection against Delta, compared to its impact now on any infection with the Omicron vaccine. We are seeing some breakthrough infections, but I would say that it remains true that it is highly unusual to see a fully vaccinated child or adolescent requiring admission for COVID right now. We are having some adolescents who are being admitted with a COVID diagnosis that's picked up at the time of admission, but they're requiring hospitalization for something other than COVID. So that would suggest that these vaccines are still very effective at preventing serious COVID infection in adolescents and children.
Well, and Dr. Moffatt, we know Children's often treats the most serious pediatric cases of COVID in the state. So what are the most common complications that you're seeing, and do you believe vaccination maybe could help prevent them or would have prevented them if these are non-vaccinated kids?
Yeah, it's a great question. Most of the complications that we're seeing for those patients who are requiring admission specifically for COVID still are respiratory related. So patients are needing some oxygen support or maybe some support from a device like a BiPAP or a CPAP device to get them through this infection. In many cases, yes, vaccination would likely have prevented those more serious consequences of COVID infection. But I would also say that this is often being seen in patients with underlying conditions that put them at higher risk for severe COVID, or that put them at a lower reserve for respiratory infection. So they're more susceptible to getting into trouble with respiratory infection to begin with. I would also say that the same study you referred to with the first question that came out from the CDC, that same group looked at the vaccine's effectiveness at preventing the multi-system inflammatory syndrome in children, or MIS-C, which is a relatively rare but serious complication of COVID that occurs a few weeks after a COVID infection. And they found that the vaccine was 91% protective against MIS-C as well. And that would be an important thing to try to prevent too.
And Dr. Moffatt, as you well know, there's no vaccine authorized yet for kids under 5. We're hearing from a lot of parents with kids in that age group who are worried about Omicron and those kids. What do you want them to know? What's the latest timeline for that?
For the vaccine, yeah, for under 5, I still think that it is likely that we won't see one, within weeks to months even. We might expect to maybe see some data in a few weeks to a month or two, but I think that we largely will likely be through the Omicron surge by the time something is available for the under 5s. I would remind families, though, that it's still possible to do everything you can to keep those children safe and to really minimize their chance of infection, and remind them that if infection does occur in those young children, still the majority of those infections are mild and are requiring supportive care at home.
Okay, Dr. Kristen Moffatt from Boston Children's Hospital, thanks as always for joining us.